The future of healthcare is online, and most health professionals are not ready for it. If you're still relying on outdated marketing techniques such as referrals or just having a local clinic and just expecting people to come to you, well, you're up for rude awakening, because in 2025, things have changed. The entire marketing landscape has changed. And not only that, the entire health market has changed. From the inception of COVID, there has been a plethora, an explosion of demand for consumers to get their health remotely, whether that is through telemedicine, whether that is finding alternative healers. Since 2020, we have seen an upsurge of demand for remote care, specifically from obviously the more younger demographic, millennials and Gen Zs and so on and so forth. So I just want to give you a couple of facts for you to understand why do I have this theory, and I'm going to make a case of why you ought to consider moving your online health coaching business or a clinic, or even building a digital clinic online in 2025. So the global telehealth market is projected to hit $335 billion by 2032, up from $104 billion in 2024. So that's roughly 3x in just 8 years. Imagine the potential of this sector with such a big demand. And this is because since COVID, virtual care has stabilized at a 38x pre-pandemic levels. This means that after the pandemic, an upsurge of 3,800% has came for remote care. This is absolutely staggering. This is because consumers had changed. People do not want the same exact things. People are sick and tired of going to a doctor consultation, to wait for 3 hours, to go through traffic, to get prepared, stay in the waiting area, and for a simple 20, 30, 40 minutes checkup. Now, we are not bashing the current medical system, but we are adapting to the new demands of our era, the new demands of the new consumers, and the new demands that majority of patients want. Imagine the difference. Instead of wasting roughly 2-3 hours to go to a doctor's appointment, additionally, if they need future checkups or check-ins, imagine how much time is wasted just going and driving simply for a checkup. Now, you may argue, well, I cannot do this. I cannot transition my clinic online. I need to do a physical checkup. For example, I'm a chiropractor, so I work with customers where I actually need to physically touch them to provide results and provide healing to them. And at the same time, there are hundreds of clinics online who have created a virtual clinic helping people with back pain, knee injuries, regardless whatever type of niche that they are, but they're specifically in the chiropractor niche. They have found a specific niche that they can apply their knowledge and their curriculum and their protocol and deliver those results remotely. So it does not mean that if you want to build an online clinic, it means that you need to shut down, the one-on-one visit. You can keep that for more serious or more aggravated type of situations. But there is a plethora, there is a huge market. Imagine the market of people who have back pain, and imagine you being able to provide your curriculum, your program to hundreds and thousands of people remotely online. And there's a science and there's a method to doing this, which I'm going to show you in this video. So this is currently done as of this moment by one of the leading hospitals in the world, the Seha Virtual Hospital, which is in Saudi Arabia, and they have created essentially a department which treats people exclusively virtually. And they're doing this successfully in 224 locations worldwide. So it's no issue whatsoever to find certain segments that can be automated, that can be digitalized, and then fulfill that through a remote transformational program. And at the same time, here's another example, Mastering Diabetes, which is very known specifically in North America for treating diabetes and pre-diabetes with their remote protocol. So congratulations for them. But here are just a couple of examples of clinics operating today. And maybe you have seen this new trend and you say, yeah, I totally understand. I want to digitalize. I want to go online. I want to serve as many people as possible. And I want to build a successful business. But what I mentioned right now, the desire of just going online is just the first step. But the second step is actually understanding that the typical fulfillment model where you have a consultation, you treat your customer, you invite the customer to a consultation, you do an assessment, you provide your protocol, your supplements, and then possibly you reschedule them for a visit or a checkup, 2 weeks from now, a month from now, 2 months from now, essentially is going to have its own limitations, and it's not going to allow you to scale and actually build a successful clinic online, because you are competing in a big red ocean. You're competing in the red ocean of practitioners selling the same exact thing, which is consultations. We don't want to compete in the same exact red ocean of selling consultations, but we want to compete the same way like a Mastering Diabetes has done. And that is in the ocean of selling transformations. They're selling the transformation of being diabetes free. And in order to do and be able to fulfill at scale, you need to radically transform your fulfillment model. You need to understand that clients want real-time support, not delayed visits. They don't want to go every single time to a medical checkup for your 10, 15 minute, check-in and just waste 1-2 hours in the traffic every single time they need to revisit yourself. Why not create a model? Why not create a technology that allows you to fulfill and provide the results that your customer actually want, but to also have leverage in scaling your business and providing the results that your customer actually desire? Customers ultimately want transformation. As long as it provides results, they do not care. They care of transformation. Now, the easier or the less pain that it requires from them, the better. But in theory, when a customer just comes and gets a consultation, do they actually get the result? Like, in reality, when you create your protocol, have you thought what are the actual steps that a customer needs? Majority of time, it's not enough just to prescribe a couple of supplements. They need accountability. They need a support group. They need constant communication via, their communication channel, WhatsApp, Telegram, regardless whatever you use. They need a video curriculum. It's not enough just to say, listen, do this, do that. Yeah, that's a starting point. But this exact model is what's keeping majority of health practitioners hindered from scaling online. And I can tell you that from the recent studies, people want to get treated at home. This is the new paradigm of getting treatment, getting healing at home through the use of transformational health programs such as Mastering Diabetes and the technology that is leveraged today in order to provide results for customers. Things like wearables, AI technology, software that monitor and track the progression of the customer. These are the new healing tools for chronic conditions. It's not enough just to provide supplements. You need a holistic transformational approach to provide results for customers. And majority of you health experts already have the knowledge. You already have treated, and you know exactly step by step how to do it. The only problem is it's not productized. It's not standardized, and it's not productized in a scalable program to deliver en masse. And there's both a science and an art of doing this. And in reality, it's not about adding or making or transforming, your practice or changing something in your business. It's just knowing how to sequence and what are the new utensils of the digital era. And we can clearly say that the new utensils of the digital era are leveraging wearables, leveraging AI, softwares like patient monitoring system that we have here at Pathway. And the new toolkit, the new utensils of this era have shown promising results, better results for treating different type of chronic condition, simply because it has allowed the idea of accountability and the idea of progressive tracking of the health of the patient. And that's why the future requires at-home care, because we need to identify and make sure that the customer makes specific lifestyle changes on top of taking the supplements and following the protocol that you prescribed. So transformation happens implementing a holistic approach of leveraging wearables, patient monitoring, supplementation, and lifestyle changes. And we can see that there's a shift in healthcare. Majority of people don't want just consultations. They want transformations. They want education. They want structure. They want accountability. I can tell you specifically that majority of the time why customers and patients do not have results is not because they do not have access to tools or the information, or they do not have access to support. It's because of accountability. Picture this. Imagine you're going and you're trying to lose weight. How are you going to lose weight faster? Going alone at the gym and just setting your goal? That may be for 5, 15, 20%. But have you seen the most successful programs out there? For example, Faster Way to Fat Loss? How do they manage to have an impact on 400,000 users? Because they understand the nature of accountability, the nature of group, or the nature of peer pressure. Accountability is 80%, even 90%, I would argue, of the success of the protocol. What is the point of providing a protocol to a customer, or a prescription, or a set step-by-step instruction for your patient, but they do not follow it? You cannot guarantee result, right? You may have the best procedure, the best protocol in the world, but if the customer or the patient does not follow it, then they will not see results. Well, you may say, well, how am I supposed to do this? Very simple. There are tools, there are softwares, like the one we have built internally. You can use trackers. You can have communication. You can have one-on-one discussion with the customers via WhatsApp, via social channels, and make sure that your customer abide by the protocol. So we know that the future of actually providing transformations in the way that Mastering Diabetes have provided, in the way that a lot of health coaching programs are providing, the way that we actually provide results for our customers, both for our B2B customers, but we also have to mention that we have a B2C segment, which is CVS recovery. We help people with CVS and chronic fatigue treat chronic fatigue in less than 4 months. We started that, was in beta. We implemented the entire infrastructure that we have here at Pathway, and we essentially tested it with our own personal clients. The entire fulfillment model, the entire system, the entire thing that we are actually teaching this, I personally tested it also on the consumer level, but also in B2B. But coming back to the new fulfillment model. The new fulfillment model needs to be systemized and needs to be holistic. The same way that Mastering Diabetes has created a protocol and a program that provides results, which encompasses the 4 key pillars in providing transformation for customers, which is course curriculum, group coaching, one-on-one check-ins, and the tracker, accountability essentially. These 4 components allows you as the clinic owner, as the practitioner, as the health expert to monitor and fulfill at large 20, 30, 50 clients with you alone personally, or with a personal coach that you trained, or a hire that you have to manage and provide care and results to 40, 50, in some cases even 60 patients at once if you have a fulfillment model. Do you think that you can build a business handling hundreds and thousands of clients just doing one-on-one? It's absolutely impossible. That's not how Mastering Diabetes have grown. That's not how I've done CVS Clinic. Now, obviously, our clinic was in beta stages and we essentially tested and improved our prototype. But it's very simply the same way that we treated our first cohort of clients, which was group coaching, curriculum, and one-on-one accountability. The same exact way that we leverage and implemented that system, we can go and scale it to 20, 30, 50, 100 clients. And imagine if you start charging accordingly. And I will create a different video on this channel speaking about pricing and how important it is, both for the customer, but also for you as a business owner. But essentially, it's a very simple model. Majority of practitioners come, they join and visit and watch the video curriculum. The support system is done via one-on-one check-in and one-on-one communication via a text message channels. Why a text message channel? Because via a text message channel, you have the ability to not only give support to one client, but you have the ability to provide support to 10, 15 clients, 20 clients at a time. And for the clients, for special cases or special scenarios where they need extra support, you may actually do one-on-one consultation. For example, in our case, the way that fulfillment actually happens for the CVS recovery is clients actually come, they do an initial assessment with us. We essentially map their issues. We create a specific protocol for them. And then once they come and we made that one-on-one assessment, they're then sent to the coach. They will actually have a customer success manager who essentially keeps an eye on them. And all queries or questions will be essentially discussed via their private communication channel. And then there are going to be 2 group calls where the coach will provide the resources, the knowledge, the teaching, and the support to progress and help people progress throughout the program. Very simple. This exact infrastructure can then be leveraged and implemented to hundreds, thousands of clients if you desire. What does this mean for the client? Why is it important, and why am I championing this type of model? Well, the reason I'm championing is that it's because this model allows and provides not only benefits for you as the practitioner, as the clinic owner, but provides benefits for the client also. And I'm going to give you a clear example. Imagine you have two types of program. One are using the traditional one-on-one consultations that requires you to go to a clinic, a physical clinic. And the other one has this transformational model where you have the program, you have the curriculum, you have the support structure, you have everything, you have the video modules, and you also get, group coaching with your practitioner. Now, who's going to get better results? The person who just goes to this clinic, gets a protocol, gets, prescription, and then leaves, and nobody checks on him. They don't have a support network. They do not network with other people. They're not motivated. Or the people who come and join program, gets an assessment, has a specific coach, gets accountability, comes to group calls, have access to resources, to video, to modules, have a support network in the terms of community who are actually part of the program, and they start at the same time. So now they have peer pressure and they're all together motivated to grow and finish the program successfully. That's why it does not only provide results and you get benefits for you as a practitioner, but also it's a win-win situation for the customer because they get the desired result. They get that transformation. So the question is very simple. Are you ready? Will you be ready for the new transformation, this new shift in the market, this new shift both in consumer demand, but also the new shift in technology, in AI, the new way that health will be delivered in the future? If you're actually interested, then you can actually join our free school community. The link is down in the description. We have many helpful resources in there, lots of video modules that can get you started with launching your digital clinic. Also, if you actually like this video, please like, share, and subscribe. I'm going to make sure to post every single week new videos, providing educational content, how-tos, and everything that we here at Pathway Consulting do in the health space. Thank you very much for watching, and see you in our next video. Bye-bye.